Evening, everyone, and welcome to Whistleblowers. Tonight, we're going to be joined by a whole number of whistleblowers that are willing to share their story and share what has been going on for them, what they've experienced, what they've seen, and highlight some of the inconsistencies they've experienced and why things don't add up for them and how they feel about it. Because what I'm hearing from a lot of them is they're actually really upset about how it's gone and how it's been and how difficult it's been to work through this pandemic. It hasn't been easy because a lot of them haven't been able to do their jobs. They haven't been able to do their jobs as they wanted to do. They haven't been able to give care like they usually do. And they've been dealing with a lot. Sorry, my internet just went a little bit there. Yes, so we are going to be talking to a whole range of people. And tonight we're starting off with Kazi. And Kazi is a care home nurse and has really kindly come on to share how it's been for her in the care home. So I'm going to bring her on screen now. Hi, Kazi. This is Kazi, and do you want to just tell us a little bit about your history, how long you've been working as a nurse, and so on?
Hello. Can you hear me?
Yeah, we can hear you.
Excellent. Hello.
So do you just want to tell us about how long have you been a nurse, Kazi?
Oh, a long time. I trained in the 80s, so I was 17. That's the first thing I did, or the only thing I did really, apart from a short break. I had a 10-year break when I had my daughter and I ran a business. So yeah, since 1983, and then about 3 years ago, I did a return to practice course for 18 months and then went back into working in this nursing home. So I've only been there about a year, just over a year, and I left about a month ago. So I haven't been working for a month as a nurse, at least. So,
Wow. So
but I'm old school, so I think that's why I'm struggling so much, because it's so different.
Yeah, I can imagine. And so you're obviously a very passionate nurse. This is obviously something that means a lot to you, and because you've been doing it your whole life, which is just phenomenal. So
it's not a job. It isn't a job. It's I suppose vocation's the only word I can sort of say. It sounds a bit cheesy, but it's certainly not just a job. I mean, the pay is rubbish. The conditions are rubbish. It's really hard work, but it's very rewarding as well. And it's like what you're doing now, you're doing something with purpose. And it's doing something of purpose and something that hopefully makes a difference. So for me, it's always been that. It's never been a job.
yeah. And so how have you found it over the last few months? What because you've left now, haven't you? You've left your job. What happened? What did you experience?
Yeah, I wanted to carry on. It's been heartbreaking because I've seen the impact of all of this on my residents, and certainly in a nursing home more than in a hospital setting, your residents are there long term, so you build up it's like a big family. So you build up very strong relationships with people. And what was upsetting to me was I saw them first very terrified, very frightened with the news coverage and the rolling death toll in red. And, a lot of them got great hearing, but they can see the TV, the big TV in the lounge with the rolling death figures. So initially they were really frightened. So that, we managed that as best we could. But then I saw them go from being scared to becoming withdrawn, losing their mojo. There was always a lot of fun and banter and silliness that went on. And that changed the whole atmosphere of the home as well, which obviously they're going to. And then from then to withdraw to then a few of them expressing depressing signals. You know, I don't, what's the point of me going on? You know, I'd rather it just kills me now. You know, what's the point? I can't see it. I can't see my family, and their quality of life just got obliterated, really. So that was hard to watch. And then what was harder was that, okay, we've got a situation, there are going to be ramifications, but as a nurse, you then want to counter those ramifications. That's your job. And I couldn't, because I couldn't say, okay, let's get your daughter in and let's have a party and I'll get a cake made for you and we'll get some music on. And, you know, I can't do any of that. I could not, there was no room for me to even mitigate any of those things. It was, that's the rules, that's the guidelines, that's what we're doing, and don't even question it.
Well,
so
that's
that was really,
and that's the difficult thing, isn't it? Because
me feel like
you obviously want to help and support these people, and I've got a very good friend who is a mental health nurse for elderly people, and she said her referrals are just through the roof, and these people are expressing a lot of suicidal feelings, and they are saying that you know they're going to die at some point. You know, they're elderly, they're in care homes, they're going to die at some point, and they would rather live until they do. You know, they don't want to be locked away. They'd rather live and see their families, see their friends.
It's a quality of life. At that stage in the game, it's all about quality of life. You know, you have to weigh these things up, you know.
Yeah, absolutely. And so how was it with these, as well as obviously not getting the quality of life, were they able to get treatment? Were they able to get support? Or how was that?
Only basic treatment that we could give them. All GP input stopped. All outpatients appointments were stopped. All domiciliary visits from appointment, like some people couldn't go to the hospital, so the mental health consultant would come and see them at stopped. All the social activities stopped, obviously, and it was unfortunate for us as well, because we had a really good social activities manager, and there was a lot. The one thing I really liked about that home was the social side of things was big. It was big, you know. Often there'd be people coming in doing gigs and different things going on, and they were really on that, and they loved it, and it created this lovely atmosphere in the home. So that stopped, and yeah, they didn't get any input other than what we were giving them, to be honest. We had a lady who had quite nasty leg wounds, and we had the tissue viability nurses input on that because they're really hard to heal. So she had been coming in every 2 weeks to monitor the wound. Suddenly she'd been redeployed. So we had to just struggle on with the wound. And also where in my day when I was trained, nurses had quite a lot of autonomy to make changes within a particular plan. That's gone. There's no room for that now. I noticed that I went and did my return to practice course. There is no autonomy at all now. So I couldn't even make a decision myself and say, okay, let's try something else on this, or try this kind of dress, because it's all got to go through the tissue viability nurse, who was no longer available. So all of those things, you know, we just literally held water for months.
Yeah.
What I did notice was that, sorry, go on.
No, go on, you go.
I noticed that urinary tract infections rose. So we had a great prevalence of that, and I can only put that down to a drop in well-being and in immune response, because urinary tract infections are quite common in that kind of care setting. But we we had a lot, which made me feel like, yeah, people are struggling just to keep themselves going, you know.
Yeah. And were they getting treatment for the urinary tract infections?
It was a phone call to the doctor, who then prescribed antibiotics. So
but nothing
they
more.
got treatment but no, there were no face-to-face visits. No.
And surely not everything can just be diagnosed over the phone. Surely that's not how care should work.
No, no, absolutely not. No. And also for those people that are, what's the word to say? Those people that are so-called end of life, and that doesn't mean that they die imminently. It means that they've got comorbidities that are not going to be treated at hospital, and that they're just going to be kept comfortable and happy in their home, and when they die they slip away comfortably with dignity. That's the plan. But and so in that framework, the GP is supposed to visit residents every 2 weeks, so that if they then were to die in that next couple of weeks, they've seen a professional, they've had medical input. Well, that's to 28 days now, and even the 28 days didn't happen. So, you know, again, this is my main beef about it all, is that we've made all these blanket changes, and we've withdrawn all these treatments and ways of doing things, and we haven't weighed up or assessed the implication of that at all. There's been no risk assessment at all. And nursing is all about risk assessment. Everything's about risk assessment. You're constantly weighing risks, changing priorities, reworking the care plan, assessing the risk, making more plans. You know about risk assessments yourself, you know. So that was my concern. It was just like, oh, we're just not doing what we're supposed to be doing. It's just like everything's on hold. Everything's become COVID related, and there's no way out of that. There's no conversation that we can have. There's no way of changing anything. It's just the way it's being prescribed, way above. And that to me is really concerning, because you've got nobody measuring anything, and you've got nobody safeguarding anything.
Yeah. And did you say that care home workers had been indemnified as well?
Yeah, that was one of the first things that really sort of made me start asking this why question, which is, all I'm saying is I want to know why these certain things. If you can give me a plausible rationale, I'll be quiet. I'm not just talking for the sake of it. I just want some questions answered. Give me those answers and I'll happily comply, you know. But I can't get those answers. And one of the directives that first came through was that all healthcare professionals were indemnified throughout the pandemic. And that concerned me because, again, I'm old school and things have changed, but I can only nurse the way I nurse. So, you know, I can only be who I am as a nurse. And in my opinion, if you're, like, say you've got a resuscitation call in an acute setting, you have to be on your ball. You have to know what you're doing, and you have to be performing that above at a more professional rate, because you're in an emergency situation. So you have to be on your game to be able to have the outcome that you want. For me, if we're in the middle of a pandemic, I think we should be more accountable for what we're doing, not less. Why would we be less accountable? It's worrying. Why would they? Are they expecting lots of negligence? Are they expecting lots of lawsuits? Why would they do that? It's the same with the vaccine. You know, all the vaccination companies are all indemnified. Very worrying.
Yeah, exactly. And but I didn't realize that all healthcare professionals have been indemnified throughout this. So
I mean, that was just a directive I saw. I haven't heard or seen anything since that, and it may well have changed, but that was the first thing that made me think, oh my goodness, what is going on here?
Yeah, because people could just not give care and there would be no
Yeah.
recourse and for any mistakes or anything like that, which is hugely concerning. And so what was it that prompted you to leave in the end?
To what?
What prompted you to leave in the end?
To leave? Well, I think it was June. We had been requested to test everybody with the nasal throat swab, and that was all of the nurse, all of the team, and residents, and all of the staff across the board. And this was a huge place. There was a care home attached to it with 60 residents. There's a dementia unit with 12 residents, and then my 32 bedded nursing unit, and then lots and lots of staff. So there must have been 300 of us tested, including residents. Everybody negative. I did that test because I thought, again, wow. I was expecting at least 1 or 2 to come back. Law of averages would tell you that 1 or 2 ought to come back if we've got a deadly virus going on. But nobody was positive. But I thought, okay, I can rationalize that. We've got a snapshot. We can see where we're at. We can see that everybody's negative, and all we need to do now is keep it that way. So that was, I agreed to that. Then all the stuff was coming out about the efficacy of the tests and lots of false positives and all of that. So I had my concerns about the test, but there was no talk of testing further. So I thought, okay, we'll just keep going. Then it was directed that we should have weekly testing. And also we had been asked to wear masks at the end of the outbreak, not throughout. But at the end, we'd been told we had to wear masks for 12 hours straight, which I did try to do. But again, it's impossible to do my job. I couldn't do a wound dressing with a mask sticking in my eye and not being able to touch it. I was dizzy, my oxygen sats dropped. I had a couple of my team who nearly fainted. So I made the decision to wear a visor, the plastic visor, and give those visors to the staff that were suffering with the masks. The owner and the duty managers of the home weren't happy with that because it wasn't in the guidelines. And then they said, we're going to do weekly testing. So I said, I'm not confident about the test, either the efficacy of it or the fact we're pushing swabs right up the back of the nose, which is quite a delicate area, very near the outer membranes of the brain. Very difficult. You're mucking around up there. And if you are mucking around up there, it's should be done by people who know what they're doing, who are trained professionals, because there are implications. There's already been a story in America of a lady who had the test and then fluid coming out of her nose. Incredibly dangerous. You can die from meningitis. Very, very dangerous. So I had all these concerns. So I raised those concerns, and then it was very quickly made clear that, first of all, my efficiency as a nurse was brought into play. Why would you not want to protect your patients? Which, again, showed me the where we were at with it, and also that I didn't consent, that I would be in breach of my contract and I would be sacked. And there was talk of them calling the CQC, saying, oh, we've got a nurse here who won't comply, and all of that. So to save all of that, I basically said, okay, there's my notice, and I left. Because I didn't to, people have said to me, well, you could do, you could fight this, it's constructive dismissal, and it is, but I don't want to waste my energy on that. What I want to use my energy for is to try and stop this and I thought, if I haven't got the fear of losing my job, then I can stop. So yeah, that's what I'm doing. And so that's why I left, because I can't do my job, and I didn't risk myself and be part, doing these tests, which I think are harming people.
Yeah, and I think that's so commendable. And I know it's so difficult for so many people to be able to do that. And yeah, I just want to commend you for
I'm
taking
fortunate,
that stance.
I'm blessed, I'm able to do it. You know, there's a lot of people that aren't able to do it that would love to do it. There's a lot of people that are doing this feeling like I'm feeling and stuck in it, not able to do it. My sister's a teacher and she's got the same kind, and she teaches people that have got hearing difficulties. Try doing that with a mask, you know, so lip read through a mask, you know. So she's in this position, dealing with a lot of stress, you know, and sticking it out. Bless her, you know, doing her best within it. But there's lots of people in these professions that are struggling like this. You know,
Yeah.
I'm fortunate. I was able to, you know, come out.
Yeah, and I think and I'm so grateful that you've been willing to speak out tonight, because this is what we need to hear, the real stories. And this is why I wanted to do this event tonight, is because, you know, you're not going to gain anything per se from this. All you're going to do is support those that are vulnerable, and you know, and that shows, for me, it shows the truth and integrity in what you're saying, because there's nothing good is coming out of this for you except knowing that you're telling the truth and supporting those. Whereas, you know, whereas the people who are covering it up are benefiting from covering it up, and those ones that are lying about this, they are benefiting. And so the truth, I was saying today earlier, that it's such a shame that telling the truth has to take courage these days. You know, telling the truth should just be the norm. You know, there should be no fear in telling the truth. There should be no recrimination for telling the truth. It should just be telling the truth, and that should be applauded. It should be
absolutely
supported.
And the fact that, again, the fact that those that are telling the truth are being punished. Again, why? It's healthy, isn't it? To have a debate, to find the truth. If we're really about care, if we're really about care, and this is really about saving, you know, saving lives, if it really is, then healthy debate and concrete knowledge of the truth about what it is we're dealing with, how we deal with it, what works, what doesn't work, and the effects of our treatment. If we can't have a healthy debate, and absolutely all of us know that we're working on the truth, then what are we doing?
Well, exactly.
What are we doing? We're not doing that. It just is rubbish. It's rubbish. It can't be about health, can it?
No.
If they're silencing those healthcare professionals who are saying on the ground, this is harming people. If it's really about health, the government should be saying, tell me how is this harming, and what can we change to stop it harming people? That's the conversation that should be being had, and it's not.
Yeah.
That's worrying.
It is. It's really worrying.
That's worrying.
And that's why, obviously, this is one of the reasons why I've been speaking out, and I'm just so grateful that you joined us, and we're willing to speak out too. And we've got others tonight that are willing to speak out as well. And I'm just so grateful to you all. So thank you so much for coming on, Kazi. And I'm looking at the comments, and they are all just so grateful to you, and they just think you've got such integrity, and they're just so grateful for you being courageous and speaking out tonight. So thank you so much.
Thank you, and thank you, Louis, for all that you're doing.
My pleasure. Thanks, Kazi. So that was Kazi, who, as we saw, is just phenomenal, and and has been struggling, but has made a stance, and we're so grateful to people like Kazi. So next, I'm going to bring on a person called Wesley, and he is a funeral director. So I'll just bring Wesley on now. Hi, Wesley.
Hi.
Thank you so much for coming on. So why don't you tell us a little bit about yourself? How long have you been a funeral director? A little bit about yourself.
Well, basically, I started off in care and progressed into being a funeral director at the start of last year.
Hmm.
And everything was going along hunky dory until this happened, of course.
Hmm.
And we used to take the forms directly into the crematoriums, but all that stopped. So everything suddenly changed back in March,
Hmm.
and we used to have a whole range of forms. A cremation one, which is filmed out by the person dealing with the family member dealing with the death. A cremation 4, which is filled out by the doctor, and a cremation 5, which is filled out by another doctor.
Hmm.
And suddenly they temporarily suspended that. I mean,
Right.
it's much easier for me, but it's not legitimate for family members, because you've got 2 doctors then looking at the body. Now, some of
Yeah.
the experiences that I've had are that the doctors haven't even seen the body, and they're still filling out one of these forms.
Right.
I've had 2 cases like that.
Hmm.
And if the body were to be taken to a coroner, they fill out a different form altogether. And you don't need the doctor's forms. But some of the coroners are sending their form back and it's saying unascertained. And I'm like,
Right.
what's going on here? They haven't even
So what?
discovered what the person's died of.
Oh, so that means they just haven't
Yeah.
even looked at what the person's died of. Okay.
Well, they may have
Seems.
they may have tissue samples, but they haven't come to an agreement of what it is. And
Right.
there just seems to be so much of this like laid back feeling with it all that anybody could be filling anything out, really. I mean,
Right.
it's a complete joke.
So that's
um,
because that's just bizarre, isn't it? That they're
it
just
is.
not, because you'd think in a pandemic it would be really important to know what people were dying of,
Yeah,
because we'd need to know how virulent and deadly this disease
yeah,
is.
yeah.
So you think it'd actually be more important now to really
It was
ascertain.
like they did all this to speed up the process. I mean, in London, we had all these what I called death camps, and there were huge temporary buildings that housed people like 2,000 bodies. And the first time I went there, I was quite nervous because there was so much security about. And we
Yeah.
went in, and they covered our cameras on our phones, so we couldn't take any pictures. And I thought, what's this about? Like, as if funeral directors are gonna take photographs anyway. But that just makes me even more suspicious. Like, there's something not quite right going on here.
Mm.
And then when we went to collect the body, they all stood in hazmat suits. And I
Right.
said, well, why haven't we got hazmat suits on? Oh, it doesn't matter. What?
It doesn't matter.
It didn't matter, no. And then as the weeks rolled on, that the hazmat suits sort of disappeared on some of the people. You know, it
Right.
wasn't. There was no strict. "Oh, you need to have gloves on and mask on," because I even questioned that, and they said, "No, no, no." Very
So,
peculiar.
these were people that died of, you were handling people that died of COVID.
Well,
So they in there.
suspected.
There was, yeah. So
I mean,
yeah.
and yeah, they were shipped out from hospitals, and of course, doctors could write on the certificate COVID, and then they could be shipped out. And it was the same in nursing homes,
Right.
because then it frees up their storage. So obviously there's this system where, oh, we can get rid of the bodies by writing COVID down.
Oh, okay.
And I had a few people,
Okay.
actually one man who was really upset because his mother had been in hospital for a couple of months, and him and his sister couldn't go in and see her, so she was sent home. She asked to go home,
Mm.
and they had to turn off her pacemaker and everything, and she was going to die anyway. And
Yeah.
she got to go home and see her son and daughter, and died the next day. And they put
Yeah.
COVID down, and he'd already registered death, and he was so upset about it. And I said, yeah, well, you shouldn't have registered the death really, but who's there to tell you this?
Yeah.
If you start registering a death, then you can't really go back on it. So
Right. Okay. And so she got registered as COVID, and
yeah,
this is the thing, but this person was registered as COVID, but you weren't required to wear PPE or anything else
no.
to deal with them. And this is where it gets so frustrating with the inconsistencies, doesn't it? It's like,
Yeah,
if this was COVID and it was a virulent infectious disease,
exactly.
you ought to be like, well, dead by now.
Yeah,
Or because you haven't been wearing full PPE to
I
handle the
haven't worn
bodies.
anything all the way through it.
But you
And when
have
you're
been
going
given.
when I go into the mortuaries at the hospitals, the people in there, I mean, some of them might have masks on, but that's about it. And there we are, loading bodies into coffins, and it's.
But you are given tape to put over the camera on your phone.
That was when we went to the temporary mortuaries, as they call them.
Yeah,
The huge
or the
death
death camps, as you
That's
call
what I call them.
them.
Well, even then, there was one of those had no bodies in. It didn't even get
Nobody's at
going.
all.
No. Anyway, they've taken
And
that.
was that in the height of the pandemic?
Yeah. Well, it came up. It came up during the height of it, and the guy told me that it was going to be used to collect bodies from people who died at home. Now, when you die at home, it's a completely different situation, because obviously you're not tied to any hospital, so
Yeah.
you have to go somewhere. And usually you can go to an undertaker of the area.
Right.
Now they were going to put them all in these temporary mortuaries. That
Right.
never happened. So I could not get my head around what was going on.
Oh, okay. And obviously, there's been talk about the Form 5 going. And
Yeah.
now, what's the concern with that? Because obviously, as a layperson, I don't know.
Yeah, sure.
Is that important? Is it not important?
Well, Form 5 backs up Form 4. Form 4
Right.
is filled out by a doctor, and you pay for it. The family or the next of kin pays for the doctor to sign off a death certificate.
Mm-hmm.
Then we had a second one who didn't know the first doctor to sign as well, and that you pay for that also. So it makes it easier money wise, and it makes it easier for us. But the whole point of having the two doctors sign off was to stop people like Harold Shipman.
Mm-hmm.
So
Right. Yeah.
now,
So it's kind of important.
Yeah, and the case I had just a few weeks ago, where a doctor hadn't even been to see the body, and the form has been accepted, and I'm like, this is not acceptable at all.
No. And so this really ties in with what Kazi was just saying about how, the doctors aren't going to see. And also, it's even more concerning when you consider the fact that she's just shared that the doctors have been indemnified against malpractice and mistreatment. And you're saying that the forms don't need to be filled out either. It just seems like a recipe for potential disaster. Really.
Well, the Form 5 was suspended to start with, and as you showed me the other day, it's completely gone.
Yeah.
So of course these doctors now can write anything on there, really. And as I say, with the case I had the other day, that's what he did. And that particular body had been taken to a coroner, and the coroner wasn't going to do anything with it. So he filled out a form, but I needed a form from the coroner, and they were, oh no, it's nothing to do with us. And then when I'm going to the doctor, I'm saying, but this isn't adequate. You need to fill out another form. And he's going, well, I can't. So then I was in a situation like, well, what the hell are we supposed to do? It's so confusing. But when I handed the forms in, they were accepted. It's just.
See, and you're not dead. This is the thing that, you really should have been sick by now. Like, by all propaganda, all this contact with bodies that have COVID on them and everything else, you should have at least been sick. Have you been
Yeah,
sick?
yeah. No, not at all.
No. And
Not at all.
that for me just really kind of blows it out the water. It's like, well, how can this be accurate then? How can this be really what they're telling us
Yeah,
it is? And this is, it's all these little underground things that we don't necessarily know about. Like, I know our movement is very good at unearthing these things about Form 5 and stuff, but I know, like, I don't really understand it when somebody says Form 5 has gone.
yeah.
But then it's been really interesting putting the dots together as we have done
Mm.
tonight and kind of going, oh, wait a minute, so Form 5's gone here, but actually indemnity's gone there. And going, how
Yeah,
dangerous
they're
is this
removing
for?
all these things so that things can be done easier. But that's
Yeah.
when it's open to corruption, of course.
Hmm.
Because if with a Form 4 and a Form 5, if you've got one doctor filling the Form 4 out, obviously he's got to fill it out accurately because another doctor's going to come and fill a Form 5 out. So they
Yeah.
both need to speak to one another. And without the Form 5, you can just write anything down, which is what I've had with people.
Yeah, exactly. And I don't know about you, but that makes me really anxious because we have lots of vulnerable people, and we've got Claire Wills Harrison coming on in a little while, who has been dealing with cases where, you know, people haven't been getting the treatment they needed, and, you know, people have been kind of getting away with that lack of care and with that lack of treatment.
Yeah,
And that's just, and this is why I do what I do, is because there are vulnerable people out there who are suffering and they don't have a voice. You know, these
yeah,
people who are affected by these things, they don't have the ability to speak out and get the help they need. I've been really heartened though to see some court cases coming up, actually, one like about the care homes, and I saw today that one's been launched by cancer patients who haven't been getting the treatment they need and stuff. So people are starting to slowly take action, which is
oh
great,
yeah,
and I'm really pleased. And we'll be supporting as much as that, whether that's promotion or you know, anything that we can, because we can't let this sort of stuff
no,
continue. And yeah, and it's just been really interesting to hear what you've had to say, because, you know, um, it's just another perspective that I wouldn't have even thought of. And so, were you rushed off your feet at any point?
we were. I mean, we do simple cremations, so in the beginning we did see an influx, but that was because people weren't going to traditional um, undertakers because it costs a lot more money, and if you've only got 4 people allowed to go, then of course you're going to want to do it cheaply. So
Yeah.
we had quite a few people that just they wouldn't even come to the crematorium, and we did it without anybody there. But during the summer months and to now, the man I work with, he's been at this for over 10 years, and he said in all that time he's never seen so many deaths from suicides, overdoses, alcohol, drugs, hanging. I mean, and it's people in their 20s, 30s, 40s, and 50s. It's shocking. It
That's
really,
just
they're going through the roof.
that's just heartbreaking. And this
It
is
is.
what I like. It's what I keep saying is, the reason I'm doing this is because I really want, like, I feel like
Yeah,
this is how you save lives, because I feel like actually what the government are recommending is the exact opposite. It's killing people. And,
yeah,
you know, and they say it's for saving lives, and I'm all for saving lives, but people are killing themselves.
yeah.
Young people are killing themselves,
Yeah,
and these
it's
people,
really concerning.
you know, I've had friends who like, I've known quite a few suicides through this, and it's just, you know, and that those ramifications, because suicides don't just affect that one person.
No,
You
no.
know, it has a ripple effect upon that whole
Mm,
family, and that whole family's then got to carry that for the
yeah,
rest of their lives.
yeah,
And, you know, and if those people have children and so on, because I know of a suicide where they had 2 young children, and, you know, those children are going to carry that, and
yeah,
it's generational trauma, and that has an impact upon their life. And can also shorten their life expectancy. You know, it
Yeah.
doesn't just, it's not just oh, that's sad, that's a bit of grief to carry. Something like that is traumatic. It's
Oh,
not,
it is.
you
I mean,
know.
I've only been doing this since the beginning of last year, but as I say, the person I work with, at one point we had about 4 of them in a row, and I was like, this is just, to watch parents crying because they're cremating their child. It's too much, really, and it's happening too often right now. And a lot of these people were probably on the edge before this anyway, but this is just tipping people over. I mean, there's no end in sight, is there?
Yeah,
It's,
well, that's the other thing, isn't it? I think it almost, if people had gone in March, right, this is how we're going to deal with it, and it'll last a year. In some ways, you could almost mentally,
yeah,
cognitively deal with that a little bit better than this whole stop, start, up, down. Nobody knows whether they're coming or going. You know, there's no clear. So it's
no,
just so
no,
hard, and and there is no end in sight. Like there
no.
is no end in sight, and I've got an 8-year-old daughter who's autistic, and she says she feels like she's got no hope anymore.
Mm,
And it's just, and I can't give her any hope because bless her, she puts the hope in me. She was really upset, her birthday's coming up, and her dad was saying that she couldn't have her whole class to her party because of the rule of 6, and she's like, yeah, but Dad, I'll have just been with them all at school. And
exactly.
bless her, he was like, yeah, but the rule of 6. And so she just muted the call. She's like, Mummy, can you get rid of the rule of 6 before my birthday, please? I was like, I will try, baby. I am trying my hardest. But, she's 8, and, and I can do things to help. But the fact that people are losing their lives and in that
Yeah,
manner and just over and over again is just heartbreaking. Like, yeah.
very sad.
And have you had to turn people away from funerals?
Well, as I say, there was a case where we had too many people come, but it was only one person over, and they wouldn't let this extra person in. There was only, I think, allowed
Just
12 in at the time. The numbers go up and down all the time. I mean, it's ridiculous, really. Um, if everybody social distances within there, it's fine. But at one point, we were only allowed 4 people. So you've got this big empty crematorium with 4 people in there.
it's just outrageous, isn't it?
It really
It's just
is.
inhumane. It's just
Yeah.
inhumane and cruel.
Well, there is
That
a video going around the internet of somebody crying and somebody else getting up from a seat to go and hug them, and
mhm.
they separate them again.
Yeah.
I mean, it's but what we're having with a lot of crematoriums where there's a lot of people want to come along, they would let the amount of people in. So say it's 30, and everybody else has to stand outside, and they can watch it on their phones or whatever. Where it
My
could be raining.
goodness.
It's
That's
the sh-
just, it's just craziness. Thank you so much for
it,
coming on and sharing, Wesley, because it's just a really, insightful way of looking at it that I wouldn't have thought of. And I'm so glad that we kind of came across you and you're
yeah.
willing to speak out, because yeah, you've got a lot of insights that lots of other people don't have. And yeah, I I don't know what I consider, because yeah, it's
Shocking.
great that your job isn't going to go anywhere. You get to
No,
keep
no,
your
no.
job, but
We've got
yeah,
plenty to do.
yeah, but it's really interesting to hear what you've had to share. So thank you so much for coming on, Wesley.
Pleasure. It really is great.
Thank you. So yeah, so grateful and interesting, but so heartbreaking. I think he'd mentioned that to me before, but I'd forgotten, and it's just so. The thought of people committing suicide is just heartbreaking and feeling like they have no hope. Yeah, so next I'm going to bring on Claire Wills Harrison. So she's a lawyer, so she's been doing lots of great work, especially for the elderly throughout this lockdown. So I'm going to bring her on now. Hi, Claire.
Hello.
Hey, love. Thank you so much for joining us. Do you want to tell us a bit about who you are for the people that don't know you?
Yes, apart from being shouty and ranty, I'm a lawyer. I've been a practicing lawyer for 20 years. I'm a chartered fellow of the Institute of Legal Executives. I'm a fully accredited member of Solicitors for the Elderly. I work in succession law, which means it's a lot of elderly issues really, because it's a lot of later life planning, what you need to do for that time in your life. So my work has naturally over 20 years taken me into many care homes and many people's homes as well, because a lot of my clients can't get out and about, so I will go and see them. So yeah, I deal with lots of a range of stuff, capacity issues, regularly do work with the Court of Protection, yeah, just a whole range of stuff to do with succession law.
Yeah, okay. And so what have the biggest issues been that you've seen through this pandemic?
Okay, so I mean, a vast majority of my clients are in care homes. So obviously I was seeing some quite shocking things at the beginning. So really very supportive of what Kazi said. I can absolutely verify 100% that when we first went into lockdown to protect the elderly and vulnerable, supposedly, and keep the NHS from being overwhelmed, which it never was, because it was only ever at 65% capacity at the height of the pandemic. What happened is they turfed out pretty much every elderly patient that they had in a hospital into a care home. And I know lots of ambulance drivers will support that, paramedics. But what they didn't do is they didn't test them for this deadly virus that we were protecting them from, which is, of course, a really good idea when you're going to then go and put them into a care home with people that have a whole host of comorbidities and are vulnerable to any virus like the flu, which is deadly and rips through care homes and hospitals every year. So they turf them out of hospital back into care homes, and there's lots of reports about that. The Public Accounts Committee have already done their own report. Proceeded to lock them in said care homes with no support services. So what they took away was all physiotherapy, all SALT, which is, if you don't know, speech and language therapy practitioners, which are really important in a clinical, for clinical diagnosis of whether people can swallow. And that will become relevant as we go on. So took that away, took physio away, took, you know, you've got complex problems in there with tissue. As you get older, your tissue viability breaks down. You need special treatment for that and clinical diagnoses. Of course, they also took removed the right for people to go and see their relatives then as well. So there was no GPs going into care homes, neither. They were doing everything, certainly in the care homes that are in my area, remotely over the telephone, which is impossible for people with complex needs. They need to see a practitioner. So that led at the outset to actually quite a high number of deaths of a lot of my clients in care homes. So I was getting sort of two deaths a week for 8 weeks, maybe a bit longer. So 16 to 20 deaths I had in quite a short space of time. And I would expect in a year to get eight deaths.
Wow.
Yeah, so the puzzling thing for me, however, because I was an advocate for some of those people, because they didn't have family and they didn't have capacity to make decisions. So the very puzzling and troubling thing for me was that of my clients that died where I was an advocate, not one of them had a COVID test, not one.
Right.
But they all had COVID put on their death certificate.
All 16?
All bar one had COVID put on their death certificate.
But none of them had a
And
test?
not one of them had a test. Oh, and I was very cautious to make sure that I documented that with the care homes by calling each time one of my clients died and saying what is on their death certificate.
Yeah.
Had they had a test and had they seen a doctor? And every time I was told no, they had not had a test, and no, they had not seen a doctor. So I asked, actually, well, who was confirming end of life or life had been extinguished? And what I found out was that anybody at that point could do that.
Mm-hmm.
So if you were just a care worker, you would be able to say that person's life has ended. You would then send that information to the GP remotely, who would then write up the medical death certificate
Mm-hmm.
with COVID in all the cases bar one, and that would then go off and that death would be registered and it would have, COVID on the certificate. So I honestly don't know what my clients died of. I have no idea, and neither do their families, because they didn't have a test. So they all had very complex comorbidities, and they were all over the age of 85 as well. Should make that clear. So yeah, that was very troubling, very worrying. Of course, that was pre testing, which they didn't have testing in the care homes when this first started. They didn't bring in testing, I don't think, until July, actually. Mm-hmm. Certainly in the area where I'm working. So yeah, it was it was very troubling. It was very, very troubling, and it must be very upsetting for the families of these, patients, the ones that did have families, to not really know what their relative died of. My concern was that they could have actually died from mistreatment and we would never know.
No. And you did a video that kind of went viral about supposed mistreatment.
Yeah.
Are you happy to share a bit about that?
Yeah. It did go. I think it's had 1 million views. And I was contacted by somebody that worked in a care home, a carer, that was really concerned about what she was seeing and the use of a drug called midazolam. Now, if nobody has ever heard of midazolam, go and look it up. Midazolam actually suppresses respiration, and it often leads to death. And it was a favoured drug for the Liverpool Care Pathway, which was supposedly disbanded, but of course I think it's probably been rebranded and packaged up into something different. So what she contacted me to talk about was the fact that there were certainly in the home that she was working in, the clientele had been put onto end of life protocols, i.e., I think Kazi was talking about this earlier. They know that they're going to die because they have complex comorbidities, but their dignity and their end of life should obviously be paramount. It doesn't necessarily mean they're going to die tomorrow, but it just means that they won't receive hospital care to try and keep them alive because of their complex comorbidities. But the end of life protocols during this were very much that person's end of life, take away their food and their hydration and put them onto midazolam and morphine to quicken their death. basically.
So they took away all food and drink, and so we're starved,
Yes.
and you'll die of thirst pretty quickly.
It's not very pleasant. No, not very pleasant. So they also took away all normal pain medication from these people. So you didn't have their normal antidepressant medication. Some have antipsychotic medication. So obviously withdrawing that is extremely negative to anybody that takes that medication, and they will become agitated as a result. And midazolam suppresses that agitation. The morphine, it will put you to sleep. And these people, of course, died. Now, she was so concerned, her and another colleague, at the removal of food and hydration, which is not, under any circumstances should not be permitted. She was feeding the residents baby food to keep them alive, because the reason why the food and the oral medication and the food had been withdrawn was a decision made clinically that those people were at risk of what we call aspirating, which is choking. Okay. Now that decision can only really be assessed and made by a SALT specialist, a speech and language therapist.
Okay.
They will go in and they will say, can you swallow some food, and see if the person coughs it back up, or they do a range of other more complex tests following on from that. And hence there were no SALT, speech and language therapists going in, because all that support had been withdrawn. So this clinical decision in this particular home was made by a GP, who are not really specialised enough to be able to do that. They're not.
And as we just heard, they've got indemnity.
Yes. And so they can't, they're not going to, face any liability for any decisions that were a mistake. Which, there's question marks in my mind whether they were a mistake or just pure I can't really be bothered type decisions. Now, interestingly, with the whistleblower that contacted me about the baby food, we went to safeguarding on it, because it was just horrific. A report was made, and changes were made as a result of what we did. And the particular client that was being fed the baby food, that had been put onto the end of life protocol, and should have, just, you're going to die, give her the midazolam, give her the morphine. She's alive. She rallied because of the changes, and she is now thriving.
She's still alive, because you made that video weeks ago.
Yes. They had to change the policy because of that one whistleblower. And it's only one person, but it just goes to show that these clinical decisions that were being made were not right. This lady is still alive, and she is thriving, and she is eating. She just needed help to do that. That was all. So for my mind, a lot of terrible decisions made by GPs that in many cases were not even going into homes. I have known GPs make a clinical decision for a client that has got very, very complex needs on a video call, and it is impossible to do that.
Yeah, my kids have had physio appointments on a phone call, not even a video call. My daughter can't walk. She's got something wrong with her leg, and they just ring me up and go, "How's her leg?" And I'm like, physio is meant to be physically there. But I just want to say, thank goodness that whistleblower spoke out, and thank goodness she got in contact with you two, because you two are just a hero. Saving one life, as far as I'm concerned, makes you a hero. And and well done. And I know it's taken such a toll on you, because you've had to deal with so much, and as well as doing all your work, you've been helping out these people as well. But you've got to take heart in that. You've done amazing to.
It does make it worthwhile. I mean, I just hope that you know, it will help more people. And that's only one home. And I mean, we have an awful lot of people, you know, in care homes in this country. Go and have a look how many we've got. And to think that many of them, and I'm really not criticising the care staff. I don't want anybody to think that I am, because the vast majority of them are doing a very difficult job in very difficult circumstances. But you know, you've got to look at the policies that managers and overarching bodies have put in place. And we need some critical thinking from these care home managers, and that's not what we're getting. You may be aware of Amnesty's report, Louise, that came out last week. Did you see it? I don't know if you did.
Tell us about it.
Okay, so Amnesty basically did a report that just basically says everything that I've been saying for the last 6 months. Okay.
Nice to be validated.
Yeah, it's quite annoying that it's taken 6 months for somebody like Amnesty to do this, but it's in the public domain. It was published online. It was also in a lot of newspapers, and it's damning. It says that the treatment of people in care homes has been inhumane, has led to their deaths in many cases. And of course, if they're just having COVID put on their death certificate, if they were in the early days before testing, then, you know, that's going to give you huge numbers of COVID deaths when they weren't COVID. I don't even regard what I am talking to you about anymore as whistleblowing, because it is in the public domain. The problem is, of course, nothing's being done about it. Still, no. They are still locking our elderly up in care homes. They won't let them out. And I need to make everybody aware that if an elderly person, and I've had this argument 2 weeks ago with a care home, one of my clients needs to go out for some medical treatment into a hospital, or they need to go and get their eyes done. They can't see. They need an optician's appointment. If they go out, when they come back, they're quarantined in their room for 2 weeks. They're not allowed out of their room, let alone, you know, they're not allowed out of the home at all. And visitors aren't allowed into a lot of homes. I mean, I've managed to get into quite a number of them by sheer persistence and ranting and swearing. Yeah, it's you know, and even when then they do go out for real necessary medical treatment, or say hearing aid appointments or opticians appointments, they're basically punished by being put back into their room for 2 weeks and isolated to save them. My question to all care home managers and anybody making this policy is, have you actually bloody asked these people whether they want that to save them?
Yes. Well, this is what I was saying. I said this to Cassie as well. One of my best friends works with elderly in the mental health sector, and they don't want it. They don't want this. They would rather take the risk. They would rather take the risk and see their friends and family. And, you know, we're taking away that choice. We're effectively imprisoning them for what? For being old? Like, that's not a justified reason to lock somebody up. And it ruins their life, and they haven't got much left, you know. So they should be having the best life they possibly can. So, and they don't want it. And this is, I was saying this, I was filming for a TV debate earlier, and I was saying it's about choice, you know. Like, yes, we should protect anybody who's in a care home and shield, but no, we should give them the choice. Do you want, like, so if somebody needs shielding, we should have the ability to shield them. You know, we should have the ability to protect, like isolate the ones in care homes that want it. We should have those abilities, and we should have those mechanisms to do that. If somebody's really anxious about it and wants that, then absolutely we should do that. But if they don't, then we shouldn't be forcing anybody to do anything. And that's always been my argument, is we should have free will on this, from masks to track and trace to you know, shielding. You know, like, I've got a friend who's got COPD. He fully shielded for the first 6 weeks, literally didn't leave his house because he was scared he was going to die. And he was going to be one of those statistics that Wesley talked about where he's going to kill himself. So he went out and he decided that's better. And he should have that choice. But, you know, he was glad to, you know, he had some of those food deliveries and stuff when he was shielding, and he was grateful for that. But actually, once he decided that that was enough, he wanted to go out again, because it was that, or his mental health was going to decline. But yeah, it's all just, there's so much, isn't there? And the thing is, as you say, none of this is even kind of just theory now. It's out there in the public domain. Everything that's been said tonight can be proven, can be verified. You know, it's all in the stats, it's all in the guidance. None of this, but it's really interesting because some of it I don't understand the relevance of until, like, you know, like you saying about salt and stuff like that. That makes a big difference, and sometimes we need these people like you guys to come on and explain it and really highlight those individual stories of people that are suffering, because it's very easy to go, oh, that's a policy and we don't understand that policy, so why does it matter? Like, what impact is that policy going to have? We don't know until people come on and explain it to us. Is there anything else you'd like to add, love? Is there anything else you'd like
just
to highlight?
to make all your viewers aware that we never locked down. I never locked down my business and worked at home because I serve a vulnerable population, and I've always been proud to be a lawyer that it serves the public. That is our job. It's our job to serve and protect the public. I went into care homes and hospitals. I have been in since March. We are not provided with PPE, none whatsoever. I have an autoimmune disease, so I'm classed as vulnerable. I have not been ill. Never once have I been ill. I have not worn PPE because it is not provided to us to wear it. And I have gone into homes and gone into hospitals. There is absolutely no reason why we cannot function as a normal society with this virus. Yes, there are vulnerable people, but yes, there has to be choices freely made by those people instead of ministerial diktat telling people how to live their lives. Life is only worth living because you know you're going to die one day. That's what makes you want to live it. And I'd just like to say thank you very much for everything that you've done, Louise, with Save Our Rights.
Yeah, and thank you too, because you've been fighting from the beginning and you're doing an amazing job. And we have our moments where we go, this is all a bit hard, but we keep rallying and we keep going. And yeah, thank you so much for all of your help and your legal advice and helping keep me like explaining things to me when I need some help and stuff. So thank you, love. Well, thank you so much for coming on tonight. I hope you get some rest tonight.
Welcome. Thank you. You take care.
So yeah, so that was Claire, and if anybody follows her on Facebook, you can see that she's been fighting for this since the beginning, and we're so grateful to her, and she's been a big support of Save Our Rights. And so yeah, we've been working together for a while now. Next, I'm going to bring on a man called Kevin, and so I'll bring Kevin on to introduce himself. Hi, Kevin.
Hi, can you hear me?
Yes, we can. Thank you.
Okay.
Would you like to kind of introduce yourself, what you do, and how long you've been doing it, and just so we've got a bit of context about who you are?
Take my specs off. There's a bit of glare here on the screen, so I'll take my specs off. I'm a mental health nurse. I qualified in 1989, so I've been a mental health nurse 31 years this year. I've been around the block a little while, seen most things, most forms of human distress. At the moment, I work in liaison psychiatry in across 3 hospitals in the Midlands. So that's basically mental health teams working in general hospitals, carrying out mental health assessments on patients who come in with overdoses, self-harm, acute mental health issues of one kind or another. I've been doing that for 4 years, but as I say, I've been around mental health and working in addictions as well for a long time. And my perspective on the COVID so-called pandemic, when it kicked in at the end of sort of March, a lot of our clients that we would normally see fairly regularly, we just weren't seeing.
Right.
A lot of those clients just dropped off the radar.
Okay.
Surprisingly, we were surprised by that. And that happened for about a month until around the end of April, and then they started to come back. But what we also noticed was, say, one of the A&Es I work in is one of the busiest A&Es in the country. And we would normally have 50, 60 patients in A&E at any time, day or night.
Yeah.
And those patients weren't there. We were having
Right.
maybe 8, 10, 12 patients in A&E, as opposed to 50 or 60.
And so this was, this was in the height of the pandemic, and
At the height of the pandemic, from March, April, right through to probably August, before it really started picking up again. A&Es were just dead.
So before the pandemic, you'd have 50, 60 people in there, and that'd be a whole range of things from heart attacks to broken legs and stuff like that.
Strokes,
And
heart problems, you name it.
And then obviously during pandemic, you'd kind of expect to have all of those and COVID people.
For sure.
But you're saying
we
that there was significantly
we weren't seeing
less
those people. We weren't seeing them. No.
But you weren't seeing a massive influx of COVID people either.
No. One of my colleagues asked one of the clinical directors, one of the senior doctors, a few weeks ago, because we had these new rules about now we go into A&E, we have to put on the kind of welding visor things, which is ridiculous.
Right.
You're trying to do a mental health assessment. So you're wearing a surgical mask and then a welding visor, and you have to communicate effectively to people through that.
People who are distressed. And
people in distress. It's ridiculous. So my colleague asked, how many COVID patients do you have in the hospital at the moment? She didn't know. She couldn't answer.
Mm-hmm. It's just nothing. So it's not hundreds. It's not.
Well,
it's
there are some people. There are people who are ill. People who are in ITU with something or another, with viral respiratory conditions. Whether that's COVID or not, who knows? Because as we know, the PCR test is hugely unreliable. I dare say some people probably have had COVID and have died of COVID. But to me, the whole thing has been massively overstated.
And when did you have to start wearing PPE? Were you dealing with clients for a while during the height?
Not straight away. Not until I think May, June time. They started asking us to wear face masks. And then more recently, it's gone onto the visors as well. Not straight away. I mean, essentially the pandemic was over by that time.
And have you been sick?
No, not at all. Well, I was said to you on the phone last night, I'm in a strange situation at the moment where I'm actually off sick, forced to go off by my boss, because Tuesday, Wednesday, I was told that if I've been a close contact of a colleague who did test positive for COVID. So if I develop any slight sniffles, sore throat, anything like that, I'll have to go off sick. And then a couple of days later, lo and behold, I did. So I'm off sick at the moment for 2 weeks. Enforced full pay, doesn't go on sick record, which is great. But it's literally just a cold. I feel fine. I've got a bit of a sore throat still, but it's not COVID. I haven't lost my sense of smell or taste. I feel fine, but I've had to go off for 2 weeks. That's a new directive from Public Health England.
And you could just back and forth that, couldn't you? Because you could end up going back for one day and then somebody else gets tested and then you're back off again. And
well, it's almost like a system to, if you want to devise a system to sort of wreck morale and sickness levels in the NHS, that would be a way to do it.
Yeah. It will, and that's the thing, isn't it? It's that back and forth and up and down and stuff. And so you said that a whole load of your clients dropped off. Where did they go? Did they just were they scared?
They did come back. They did come back, and they came back in numbers. But probably, I would say 80% of the people I see now were massively affected by COVID. We've seen an increase in drug and alcohol. we've seen an increase in self-harm, suicide attempts, domestic violence. The isolation and lockdown for a lot of people has been really bad. Interestingly, a lot of mental health clients, especially the younger ones, but even older clients, have actually been really sensible about assessing their own risk. And they'll say, look, I'm not that worried about it, actually. I kind of know it might be risky, and technically I may be a little bit more at risk, but I'm not actually that bothered. They've been really sensible about that. But what's really got to them is the isolation, the loneliness, the not being able to see their families. All that stuff has been horrendous for their mental health.
Yeah, and because obviously with the drug and alcohol as well, you know, people are used to being able to go to like AA meetings and NA meetings and stuff, and they were all moved to Zoom.
It's
and
all
then
online.
some have reopened, but there's limited numbers and stuff like that. And you know, and there's a reason people go to meetings on a regular basis. That's because
for sure.
you need continual support.
For some people, those kind of meetings are a lifesaver. You know, and we do know, and the government is currently refusing to publish the numbers, but we do know that suicides are going up significantly.
Right, and is that currently they're going up?
Yeah.
Right, and do you think? So. And are you seeing suicides and kind of new cases coming from people that have never been in your service?
Yeah, the
influx of new people.
We see, we are seeing a lot of people, especially younger people, uni students, even younger, 16, 17, 18-year-olds, overdosing, really struggling.
Right. And these are people that haven't been
previous
utilising
mental health
services prior?
Not at all, no.
And what is the kind of long-term prognosis? If somebody at 16 gets to that point of suicidalness, you know, how likely is it that they're going to suffer on a long-term basis, make a full recovery? How does that usually work out? How does that play out usually?
It's very difficult to say. I mean, when I'm working with young people, I've spent many of my years working with young people. I try and keep them out of psychiatry, to be honest, and that may sound like a bizarre thing for a mental health nurse, but once you get labelled, you get stigmatised, you get into the system, a lot of psychiatrists and doctors will put you on antidepressants or psychiatric drugs, which can be then very hard to get off, and they're not really recommended for under 18s or even under 21s. So I kind of try and keep young people away from drugs, to be honest. There are alternatives, and I'm always happy to explore those alternatives with people. So in terms of prognosis, it's very difficult to say. But it's certainly not doing anybody any favours to pull them into a mental health system at 16, 17, 18.
No.
Put them on very powerful drugs for what is essentially a social situation.
Because I suffered with depression in my youth, and then I had a very difficult life situation. So I hadn't been on medication for a while. I'd been off, and I'd kind of was doing quite well, and then I had a very difficult situation in my life to deal with. And I remember going to my GP, and he said, "Well, no, what you're experiencing is a kind of a proportionate response to the difficult situation."
That sounds like good advice.
Yeah, so he didn't give me drugs at that point. What he did is he offered me weekly appointments.
Okay.
And that's the thing, isn't it? These young people, as I was sharing, Wesley was saying earlier, you know, there isn't hope. These people can't have hope because they don't know when this is going to end. And I think that's the hard thing, isn't it? They can't go, I've only got 2 more weeks and then it'll be okay. You know, you could kind of almost.
It's the uncertainty for sure that will get to anybody, and I know a lot of my colleagues as well feel the same as I do. Perhaps wouldn't be prepared to speak out, but they certainly feel the same. A lot of people's mental health has suffered through this whole thing.
Yeah.
At the end of the day, we're human beings. We're social beings, you know, and we're put on this earth to be social beings, to love each other, to have intimacy, to have hopefully good supportive relationships. And this whole social distancing, mask wearing, it's destroying our humanity.
Yeah, absolutely. And this is the thing, is those effects don't just go away. You know, if lockdown and all of it this was to go away tomorrow, they wouldn't all feel better the next day.
No, I really worry about kids. I live in a small market town, and I was in town the other day, just going for a coffee. I don't bother wearing a mask. Lots of people do. That's their choice, but I don't. And I was having a coffee, sitting in the local cafe, and a woman walked by with a pushchair, a baby in the pushchair. Couldn't have been more than maybe 12 months old, and the baby was masked up as well. I just thought, what are you doing? You know, what are you doing? This is child abuse.
It's just...
And how do babies learn to socialise? They learn to socialise by reading their mum's expressions, by reading strangers' expressions, pardon me, by watching people laugh, smile, you know, picking up other people's emotions. If your mum is wearing a mask 8-10 hours a day, that's very unhealthy for the mum.
Yeah.
But that's incredibly psychologically damaging for the kid.
Yeah, because they did that experiment, didn't they, with
Kim
blank face.
Yeah.
The blank face thing, where, you know, babies were kind of trying to play with an adult, and the adult just kept a really straight face and didn't respond facially at all. And within about 5-10 minutes, all the babies would start crying because they just...
You don't socialise. The whole thing, to me, pretty much from day one, to be honest, I didn't believe it was going to be 3 weeks to flatten the curve. I kind of knew it. There was more to it than that, a bigger agenda. And I can sum it up really in one phrase, and anybody that's unfortunately been through trauma will probably identify with this phrase. It's really, in my view, this is trauma-based mind control. Government policy is trauma-based mind control.
And is that what are you seeing a trauma response to this?
Absolutely, yeah. Anxiety, depression, acute stress reactions. People will self-medicate with drugs and alcohol. Certainly some people are doing more of that. So yeah, they're kind of stress responses that you would expect.
Yeah. And people don't understand that and this length of trauma as well, because this isn't a short period of trauma. This is a long period of trauma. And that is, as I suppose, likely to result in lots of people having post-traumatic stress disorder.
Yeah, I mean, Boris or Valence or whoever, Hancock, could come out tomorrow and say, look, you know what, we've made a massive mistake. Let's all scrap this social distancing. And actually, the evidence on mask wearing isn't strong. You know, you can take your masks off. There will be people going around in 5-10 years from now still wearing masks and still afraid of some invisible virus out there, because people become habituated to, you know, a kind of new normal. This will never be my new normal, but people get habituated to the mask wearing, to the social distancing, to the hand washing, and it will take years for some people to go back to normal, if they ever do.
Absolutely, and that's crazy, isn't it, to think that some people will still be doing this, because it won't dissipate, and you know, and we've got people who've already got OCD as it is, and you know, this, I can understand how this could really trigger it.
If you've got fragile mental health, just the very slightest thing can just make you crash. It doesn't take much. Sometimes just the smallest thing, and this is a huge thing for most people, even people without so-called mental health issues, you know, people who are ostensibly doing well, doing okay with their mental health. A lot of those people are really struggling as well. So people with fragile mental health are going to be struggling big time.
Yeah, absolutely. And for you, because obviously furlough's about to end, is that a concern to you? Are you expecting another influx of issues?
Yeah, I mean, they're talking about the second wave of COVID. I think there'll be certainly a second wave of self-harm, suicide attempts when the furlough ends, for sure. Probably more alcohol and drug issues again. Certainly more self-harm, I think, more suicide, more desperation, more depression, anxiety, post-traumatic stress, like you say, you name it, we're going to see more of it, I think.
Yeah, so you must be, and what a weight to carry in your job to be suddenly, and how frustrating to be watching all this happen at the hands of the government, you know? There's one thing, people suffering from mental health issues because of like various issues but to have a whole swathe of people coming in because of the government's own policies, the government that are meant to be supporting our people.
Yeah, well, we get these platitudes from politicians from time to time, oh, we value mental health, we support mental health. I'm sorry, you don't. Put your money where your mouth is, Mental health services have always been underfunded in this country. They've always kind of been the Cinderella service.
Yeah.
And that's just going to get worse, I'm afraid.
Yeah, my goodness. And it's just so people really can, because today's actually World Mental Health Day.
Yeah.
So,
oh yes, I should have mentioned that. Yeah.
It is, isn't it? And so many people live with mental health issues, and it's hard enough anyway. And to do anything that makes it harder, I just can't abide by it at all. And to not then put the resources in place. And as you say, they just offer these platitudes. They don't follow through. They never have. And I don't know this government ever will, which is why, this is one of the things why we're like fighting for a real democracy and reforming healthcare as part of that, because something needs to change. We can't be just reliant on big pharma for all of this. As you say,
sure.
Putting teenagers on psychiatric drugs is not a good step for them. And and it needs so much more money putting into it, or just money being better utilized as well.
And people, we talk about patient consent and choice. There's very little choice very often in psychiatry. We need more talking therapies. We need more evidence-based therapies. We need to put patients really at the center of things. And at the moment, they're not.
Yeah, and it's funny, isn't it? Because some people, and also looking for the cause, not just treating the symptom, because that's something that frustrates me. Because I actually really suffer if I eat gluten. It actually has a negative effect on my mental health. And now that's something that I actually kind of found out by accident. But I really noticed it. If I eat gluten for a few days running, my mental health will dip, and then if I come back off it, and these are things that are worth exploring with people, and because for me it makes a significant difference, and I just have to take that self-responsibility and do that myself. And having said that, I was eating gluten earlier today because I was in a rushing through London, so I'm not perfect, and but
we're all human beings, we're all human beings. And the one kind of takeaway point I want to make from all this is, in the 35 years that I've been in mental health, I've seen we're slowly losing our humanity. And what this whole pandemic business has taught me is we've got to hang on to that spirituality, that humanity. We're one human family.
Yeah, and that's the thing, isn't it? It's all about connection, and that's something that's really been highlighted, is how much we've, over the last few decades, they've really worked on dividing us. They've worked on dividing us on the basis of race, class, religion, Brexit, Remain, Tories, Labour, right wing, left wing. There's just so many implemented divisions between us all, so that we're almost isolated, and that's when we lose our humanity, because our humanity is based on connection with others. And that's why things like AA meetings work so well, I think, because it builds a connection with people that understand you and that are welcoming and warm and loving. And that is what we all need and we all thrive on. But it's just not encouraged. We're encouraged to sit behind screens. We're set to compete with each other. We're not encouraged to have.
It's a very dysfunctional society.
Yeah, you know, all youth clubs have been kind of disbanded, so the youth don't hang out, you know, and we used to have like working men's clubs, and we used to, people used to have a society and friendship, and that's really gone. And, you know, would you say that sort of, those sort of things going away has correlated with a rise in mental health issues?
Yeah, I mean, years ago, 20 odd years ago, I used to do youth work. So, I, like I say, I've worked with young people as well as adults for quite a few years. And you're right, those things like losing the youth clubs, which were a big part of the community, it's a massive impact. Society generally has been fragmented. It's divide and rule, us versus them. These kind of superficial divides, you know, like I say, ultimately we're all one human family. We all need to be valued, to be appreciated, to be recognised and validated. We've all got unique gifts and talents to bring to the table. And it's about recognising those.
Absolutely. Thank you so much for being willing to speak out, Kevin.
Okay,
you know,
you're welcome.
I hope you enjoy your 2 weeks off work.
I'll try. I'm not self-isolating. I'm not self-isolating.
Good. And that's the thing. That's what we have to do. We have to just not acquiesce, and we have to be courageous and speak out, and, you know, and recognise what's going on here. So thank you so much for joining us. And it was lovely to meet you. Thank you, Kevin.
Okay, cheers. Bye.
So that was Kevin, and obviously working at A&E, and it's shocking that, you know, regularly it would have 50, 60 people in, and then it had 8 to 10 people in during the pandemic. It's like, where did the original patients go? But then why also was there not hundreds of people coming in with COVID? So we've had a few changes of lineup. We've had a paramedic stuck at work, and unfortunately Emma Kenny has not been able to make it, but she will come on and do an interview another day, and do a full interview. So the last person we're going to bring on is a woman called Sadie, who's a teacher. So I'll just bring her on now. Hi, Sadie. Thank you so much for joining us.
Hi, Louise. Hi.
Oh, can we hear? There we go.
Can you hear me okay? Yeah.
Yes, there's a little bit of a delay, but that's okay. So do you want to just tell us a little bit about you and about the work you do?
Yeah, I'm a very experienced primary school teacher, and I am also I've also been very vocal about all of the situation with the lockdowns and everything. So I have been speaking to a lot of people, speaking to a lot of parents, and I wanted to really share some of my experience with school and what I've seen, particularly with the fact that risk assessment that has been brought in at school I work at, and lots of other risk assessments that I've seen from other schools. So the risk assessment always has to be written when the school is going to open up, and it's all about, you know, protecting staff, safeguarding children, all of that kind of thing. So yeah, I've looked through the risk assessment very carefully, and I thought it'd be interesting to share with some of your listeners the things that schools are implementing, particularly the school I work at, and some of the other schools that I've read about. So yeah, quite shocking. Yeah, quite shocking.
Yeah, no.
So
and so the primary school, so these are the children.
Yeah, so work at a primary school. Yes, so children from 4 years old. And so my situation at the moment is I work in a school. I have been employed there for 8 years. I have recently written a new curriculum for the school with a very kind of child-led focus on learning, an inquiry-based curriculum. I'm really excited to roll it out. And yeah, it's sort of it was all looking very positive for this year, but my crime was I attended the London protest on the 26th of August, and I was photographed in the mass media. So photographs went online of myself, my husband, my children, and some parents at my school saw it, and they made a massive deal about it. They were putting lots of photos on their parent Facebook page and made a big deal about it, and were calling for me to not go back to work. It was unsafe. How on earth could I be expected to teach children if I had these views? That I had obviously not socially distanced. I'd probably caught the germs of the 35 to 40,000 people who'd been there in Trafalgar Square, and I was obviously going to bring COVID to the school. So I was asked to not go into school for 2 weeks to self-isolate, and which I did. I didn't go anywhere near school for 2 weeks, and I'm not sure that I completely self-isolated really, but we didn't go into school. The children didn't go into school. During that time, we decided, once I'd read the risk assessment, had discussion with my husband, we felt that we did not want the children going back to school to be in that environment, so that we were going to home educate them. The situation with the parents escalated quite somewhat, and there were letters of complaint were put in. None of the letters of complaint were anything to do with my teaching. Nothing to do. In fact, there was lots of very positive comments made about my teaching, my abilities within school, the things I'd done for school, the relationships that I formed with the children that I teach. And it was all to do with the fact that I had been at a protest. So, yeah. So anyway, cut a long story short, I am currently signed off with acute stress reaction from the experiences that I've had, not being able to go near school. This has been literally like a second home for me. I worked, did everything I could for the school. I absolutely loved it, but very, very different place under the new risk assessment and the guidelines and things that have been implemented there. So I didn't want it to be a place for my children to learn in, and I also know that there are many parents who feel similarly. It would appear that head teachers have discretion at how they implement different regulations of the government and guidelines, and some schools haven't made great changes. Some schools have made significant changes. The school that I work in has made very significant changes. So
okay,
yeah.
What changes is your school implementing then?
So my school has implemented mandatory masks for all teachers, and this is in the primary school. So teachers don't have to teach with a mask in the classroom, but they can teach with a visor. Right. As soon as the teacher has to leave the classroom to walk their children to break, or somewhere else in the school, they have to put a mask on. So any communal areas, if you go into the staff room, which is where you can go in to make tea, coffee, I think you can even eat in there, you have to wear a mask to go into the staff room. You have to wear a mask at the start and the end of the day to see the children into your classroom. Frankly, I do not understand why. It is to do with parents. So they have asked all parents to wear masks on the school grounds. So as soon as the parent steps into the playground or into any of the school grounds outside, they have to put a mask on. And I did see no exceptions somewhere written. So you have to put a mask on. So the teachers have to wear a mask at the end of the day to see the children out from their classroom. Bearing in mind, you've been with those children all day in your classroom not wearing a mask, you have to put them on at the end of the day to see them out of your classroom. It's just a nonsense, and it's purely done to appease parents in all of this. We are not allowed to walk around the classroom. We have to teach from the front. So if a child needs some support, you're not allowed to go and give them really one-to-one support. All one-to-one and group work has been banned. So there's no work like that. If you are to give children some support, you have to talk next to them. You can't talk to them face to face. So that's crazy, and that's to avoid eye contact and talking face to face with children. So honestly, how as a teacher you are meant to really give children support when you're supposed to be teaching from the front and you're not to walk around? You're avoiding looking at children's work while you're teaching. You're giving kind of verbal feedback and things from the front of the classroom. So
I'm just looking
teachers,
confused through this one. I looked horrified through everyone
oh, it
else's,
gets
but I'm-
worse. It gets a lot worse. Trust me, it gets worse. So this is directly from the risk assessment. Teachers are to give social distancing reminders continually throughout the day. So bearing in mind you're still in a bubble, so as children are in a bubble, they shouldn't have to socially distance because they're in a bubble, they're with those children all day long, but teachers still have to give them, and they're not allowed to mix with any other groups of children anyway. So if they've got a sibling in the school but in a different class, they're not allowed to see that sibling, they're not allowed to hug them or give them a kiss or high five them even in the corridor if they see them around. And I know, I have heard of stories where children have been told off for this. I even know of children in secondary schools where the children have been given detention or put in isolation for touching other pupils during a lesson. And I also know of children who've been given detention and isolation for taking their masks down when they're walking around in the corridors. I absolutely cannot believe that school is meant to be a place for children to learn. It's supposed to be nurturing. You know, these are our children, these are our next generation, and we're teaching children to be afraid of each other. We're teaching children to have fear and to be wary of somebody else in case they give them something to you. And I can't imagine the long-term effects of what this is going to have. And this is schools around the country doing this. What is that going to do to the children who are eventually going to be adults in this country?
Well, this is the thing, and I was speaking to another teacher, and she works in a secondary school, and all the students have to stay in the classroom. So the students now don't move from classroom to classroom, the teachers move, and the students have to stay in the classroom. They're not allowed to go get any water. They're not allowed to go to the toilet except at lunchtime. And so she's been sneaking water into them because the kids are thirsty. And also because the teachers are now moving between classrooms, the teachers are not allowed to sit down because they would each sit on the same chair and that might transmit a virus. So every teacher has to stand up for the whole day. They're not allowed to sit down at all. And I'm just like, the fact that she's having to sneak water into the school to give to thirsty kids, like, our kids shouldn't be thirsty. Like, that's a basic
No, it's
need.
disgusting. It's a basic human right. It's a basic human. Same with going to the toilet. And I know schools are implementing, in the risk assessment I've read, it's one child to the toilet at one time. I'm not being funny. If you have a class of 4-year-olds and 5-year-olds and they need to go to the toilet, you can't make children wait because there's 3 or 4 other children that need to go in front of them. It's child abuse. It's neglect. It's absolutely shocking. And I just feel so strongly that this is actually happening, and I know this is happening up and down the country. This isn't just my experience of it. This is happening in all schools. One of the other things that they've done in schools is they've banned singing. We know that they've banned singing, and they've banned instruments. So wind instruments aren't allowed. You know, can't be used. So I mean, I have to say, there's probably teachers up and down the country that are thanking that no recorders. There's no recorders. This is like. This is a blessing that, you know, because everybody loves a recorder lesson. But I'm just, you know, it's the fun that's been taken out of it. You know, it really is, and I think that's just so tragic. That, you know, in the situation. Another thing is testing kits. So schools, I don't know if people know this, but schools have been issued with testing kits, and our school had the same. You know, we had a box of kits. I know that there's none left. So they've need more. Now I know I've obviously read, as I'm sure many of your listeners have, and you as well, you know, we looked through the Coronavirus Act, and we're aware that, you know, these tests are meant to be used when with parents or a legal guardian is present. But there is also the exception that if the one isn't present, then another trusted adult can do this. Now, I'm not aware of schools testing any children who, you know, without parental consent. I'm not aware of that happening. But, you know, people should be aware that it's there in the Coronavirus Act that schools do have the powers to do that without if a parent or legal guardian isn't able to attend and they feel that a child has symptoms, then they can test the child. And we have seen some of the most horrendous stories of children being damaged from these tests, and particularly from nasal tests.
And traumatized.
Yeah.
Like, I have as I mentioned, I've got an autistic daughter. There is literally no way on this earth that I could get a nasal swab up her. Like, it would just, she's got sensory issues, she's got anxiety issues, she would just scream the place down. It would just be abusive for me to do it. My boys are pretty, they're pretty nonchalant. They'd just go, yeah, sure, mum, stick something up my nose. That'll be funny. But
Yeah.
the girl would be traumatized. My boys are a bit gross like that, but my girl would be absolutely traumatized. And it is, like I say, they're ruining the fun. And I have another friend who's a teacher at a special needs school, and they were open as normal the whole way through lockdown, because, as we know, there were certain conditions that meant people could go to school, and that was if they had special needs. And but these are children that pretty much lick their teachers. And they had no PPE, there was no social distancing, no nothing, and not a single case of COVID.
Yeah.
But now they're having to implement all these measures which are really distressing people. And it's like, but we didn't do that through lockdown because those things weren't suggested at the time, and nobody got COVID. So why do we need to introduce it now? And she actually said something that in the safeguarding policies, it should have something in there saying that if you are preventing the child from participating in normal social interaction, that it actually often goes against a school's original safeguarding policy. And surely these COVID regulations are therefore against the school's own safeguarding policies, because they are preventing children participating in normal social interactions. And that's obviously usually meant to be kind of like if teachers are just doing that to like one child, because I don't know, it's to protect usually just one child at a time, not the whole school at once. But and apparently, also under abuse, neglect and emotional abuse, it may include not giving the child the opportunity to express their views, deliberately silencing them, or it may feature age or developmentally inappropriate expectations being imposed on children. Now, I would say not touching your friends is an inappropriate expectation of a 4-year-old.
Absolutely, 100% agree. I think it's shocking. I really do. I think that the position that schools have taken is really disappointing. And I know that not all schools have taken quite the draconian measures that that I've witnessed, but I know that it goes against what a school is meant to do. A school is meant to nurture, supposed to encourage children's lifelong love of learning, and it's supposed to teach children about social interactions with other children, about learning to play and through touch and emotion and all of those things. And it just feels so wrong that we have children in a situation where they are being shouted at for touching other children. I mean, I've seen this firsthand because I've taught throughout lockdown at the beginning when we had key worker children in, and my 2 boys, and one of my children is autistic as well, and he was in school with his twin. They were playing football at break time or lunchtime, and they scored a goal, and they high-fived each other because they're twins and they scored a goal, and that's normal what you do. And one of the TAs at school shouted at them for not socially distancing, and he shouted back to her because that's what he does. So he shouted back to her, "It's a load of nonsense, don't you know this is all a load of rubbish, and we don't have COVID." He said, "Well, that's your opinion and you should keep your opinions to yourself." Well, frankly, for anybody who works in school to be telling that to a child really needs to question what they're doing working in a school, because that is absolutely not what we should be teaching children to do at school. It's to keep their opinions to themselves. It's well, they were really disgusted and very angry, and they didn't want to go back in. So
I'm
yeah,
not surprised.
no.
And this is the thing is, you know, school is meant to be a home from home, you know, that was, you know, they spend so many of their waking hours, you know. We had a questionnaire sent out going, if your child hurts themselves, would you be happy for the teacher to break social distancing to comfort them? And everybody was like, yes, you know, if my child is hurt, please hug my child, because that is what is meant to happen. You know, it's meant to be a home from home where they're nurtured and they're loved. And during lockdown, because this is the other thing that has really concerned me about schools, which obviously isn't an issue now they're back at school in theory, in the kind of way that they are. But during lockdown, did you find that children were suffering, that there was issues with, you know, did you have any children that you were concerned about from your school?
Yes, yeah. I mean, I haven't gone back since the new term started in September. But during lockdown, yes, there were children. What was really concerning was our very vulnerable families. So families that, you know, we do give extra support to, they're a huge concern, and they were the families that weren't really coming in and weren't really accessing the support. So I think that the government have massively failed very, very vulnerable families throughout all of this, and they are the families that aren't getting the support that they need at all. You know, and there's children out there who rely on coming to school for, you know, some love and some care, you know, for a meal, maybe a hot dinner and things like that. And those are the children that I know that there'll be teachers all over the country who, you know, will absolutely, you know, hear those words and think, totally, they are the children who we were really concerned about when we shut the schools. And I can tell you now, there wasn't a single teacher in the school that I work in that wanted to close. That everybody wanted to stay open. There was no teachers that said, great, we get some time off work. Nobody. Everybody was massively concerned when they said, we're closing the schools down now to stop this. Nobody wanted that at all, you know. And I heard awful things about people saying, oh, lazy teachers, they don't want to. That's absolutely not true at all. All the teachers that I know, and I know dozens and dozens of teachers, were really, really concerned about it. And these were teachers who weren't interested in, you know, protecting. It wasn't about their health or anything. That didn't even factor in this. It was all about the children and protecting those families and those children who we know needed to be in school. I'm now kind of changed my opinion on that, really, having kind of seen some of the things and heard the kind of horror stories that have been going on in some schools. And, you know, we've removed our children from school because I don't want them in that environment. I want them to be with us and for us to educate them, because I don't want them to be taught to touching another child is, you know, against the rules. And I just think it's terrible. Yeah.
And that's the thing, isn't it? It's all about, you know, I've really felt for those poor children. You know, for me, you know, I have a big emotive reaction to domestic violence situations, and, you know, and domestic violence increased massively throughout lockdown, and children who were at school would obviously have respite from being in that situation when they were at school, but for them to then be stuck at home where domestic violence was increasing and they get no respite from it and no break from it and no support, I just can't imagine how traumatized those children must be right now, and with no way of speaking out, you know. And I know there was you know, there was a family not far from where we live in Sussex, where the dad murdered the woman and their two children. You know, and that was back in April, I think it was. And it's like, this is the reality for a lot of children. And, you know, and I read a report as well about children going hungry, not eating for days, literally not a morsel. And it's like, how can we have a government that does this? Because poverty is a choice. You know, having people in poverty and living off food banks is a political choice. There is absolutely no necessity for it. The country has enough money to make sure it doesn't happen. And and they choose not to, you know?
Yeah, I absolutely 100% agree. Definitely. It's total tyranny, frankly. It's disgusting. Yet we know that our MPs have just voted themselves a pay rise. So,
Yeah.
you know, this is the people that we have, you know, governing our country and making these decisions for us. And yeah, it's just absolutely disgraceful. It really is. So my kind of plea really to your listeners and anybody who has a child that's in a primary secondary school is ask to see the copy of the risk assessment and have a look and see what is actually going on in your school and what they're kind of doing with any kind of enforcement of these kind of rules, because you know it will state in there how many times they want children to wash their not want how many times they make the children wash their hands a day. So it's on average about 6 or 7 times. It's more if they have PE, and there are, you know, schools have hand sanitizer in every classroom, things like that. So, you know, if you don't want your child using hand, you have to, you know, actively tell the school that you do not want your child using hand sanitizer products, because we know that there's products in there that are very harmful to children's lungs. So yeah, I mean, there's a real sense that schools want to keep parents away as well. We're having no parents' evenings. If we have meetings, they're to be done via Zoom. There's if you know, visitors coming into school now all have to be kind of temperature checked and things like that. Everybody had to have had a COVID test to come into school. They've seems to have been scrapped now, and it's just temperature checked, you know, and a questionnaire, and then they can kind of come in. But yeah, there's the other thing that is really sad is that children aren't allowed to bring sweets into school anymore and hand them out. And that's always that's always a tradition that children do, and you know they can't do that anymore. There's no sharing or bringing in anything from home, so there's no show and tell. In fact, in school that that I work at, I've heard of the children not only allowed to bring rucksacks in, they have to empty all of their contents of their bag at the gate. Parents have to take the rucksack home, and then they have to kind of struggle into school with their water bottle and anything like that. So it's just lunacy. It is madness. Yeah. It's complete madness, and you know I'm not making this stuff up. This is really happening. You know, so yeah, my heart goes out to parents who aren't in a position to to remove their children from that, and they have to have their children in school because they're working and things. And it's just tragic. It really is.
It really is. So, because it sounds like at your school, the parents are putting a lot of pressure on to maintain the regulations, and and I'm really sorry for the way they've treated you. That's just horrific, and I'm so sorry that you've suffered in that way for just standing up for what you believe in. And I'm so grateful that you do stand up, and I've seen you at many events, and your husband and your lovely children, and your husband did a great job helping lead today in Brighton. And I'm so grateful for that you guys are always there and adding to the numbers and adding to the voice, because that's so important, and you should have the freedom to do that without suffering persecution for that. But it sounds like the parents at your school are quite vocal in what they're saying, and therefore they're getting quite a lot of the things like the masks on to go greet the parents to kind of appease them. So would you say that if enough parents put pressure on the other way, that there could be potential for
yes
change?
Yeah, I would. And I'd also like to say that it hasn't just been negative. There's a lot of parents who have have massively supported me, and I'd like to thank those parents who stood up and also faced terrible abuse themselves for for defending me and my right to voice my opinion and my right to protest as well. And they have also been verbally attacked, and actually, in fact, one person was threatened with something, with physical violence as well, on a message. And it's terrible, but I do think people have the ability to stand up and definitely to make their voice heard. And if you are a parent at a school who doesn't like the way the school are running things, then you have the ability and the power is always there for you to to do something, to start a petition, to form another kind of Facebook group, like-minded parents at your school. Make a stand. Don't acquiesce to their rules of wearing a mask on school grounds and things, you know, write in, tell the head teacher you don't want to do that. You're not, you know, you're not prepared to do that in front of your child. You know, I don't wear a mask. I've never worn a mask. I don't even own one. You know, none of my family do. We know the science behind this, and I will absolutely not acquiesce and bow down to any of this absolute nonsense, because, you know, I have watched so many scientists and I know what is going on, and I know, you know, what is behind this. And the fact that we've had recently, how many thousand scientists? That's 70,000, 7,000 scientists coming together, you know, forming a block, saying, you know, how absolute lunacy all of this is, against 5 career politicians that we have, who are absolutely not listening to any of the science behind this, because they have their agenda, and that is where they're going with this. And it is just disgusting. It really is. And I know everybody, you know, agrees with that. I know people, your listeners and everything, will agree with that. But we have to we can't, like Kevin said, you know, he doesn't wear, you know, he makes that choice. He doesn't wear a mask. And like Claire was saying earlier as well, it's not, we can't give in to these kind of crazy, we have to stand and make our stand, and we have to try and bring as many other people as we can on board with it. You know, if it's speaking to 1 or 2 people a day, you know, that is good. You know, getting people on side, waking people up, telling them where to go for alternative news. Yeah, definitely.
Absolutely. Thank you so much for joining us this evening. Yeah, and thank you so much, because people need to know that this is really happening in schools, you know, because we hear the horror stories, but we kind of don't want to believe it. And one thing I've seen recently, my newsfeed yesterday, I scrolled through it, and there was 4 pictures of 4 different children's hands that had just been destroyed by all the hand washing and hand sanitizer, like literally the skin peeling off. And, you know, so we need to be really aware that even if our schools aren't doing it, we need to be campaigning to support the ones where they are doing this, because that's the thing, we're meant to be united, we're meant to be one, we're meant to be looking out for each other. So because my kids' school isn't that bad, it's not perfect, and to be honest, I actually haven't had quite the time to write to my school on behalf of my own children, because I've been so busy. But I've got some other parents on it, and we're kind of building up a group of us so we can put a collective voice together, just to challenge the few things that they do. But we should be supporting, and Us for Them is a really great resource for that. They're fab. So if anybody does need some specialised school support, Us for Them is great, and I think they're a wonderful campaign. But thank you so much, Sadie, and well done for being brave, and well done for standing up for what you believe in, even if it has put you in this position. But you're
all right. We're one of many, Louise. But thank you to you. Thank you to everyone who I've heard tonight. Absolutely brilliant. We all just need to keep fighting.
Absolutely. Thank you so much, Sadie.
No worries.
So that brings us to the end of all of our guests, and I just want to say thank you to them all, to Kazi, to Wesley, to Claire, to Kevin, and to Sadie. Just how courageous, and I'm so grateful that they came and spoke out, because I've had so many others message me and say, I can't speak out, I will lose my job. And how awful is that you have to make the choice between truth and survival? Like, that shouldn't be a thing. You shouldn't have to make that choice. And, you know, so as I said, we've had paramedics coming in, you know, who didn't have any work to do for months, and who are taking people to ICUs at the moment, who and they are empty. They're empty. The ICUs are empty. The cases are supposedly going up, but yet the ICUs are empty. You know, we've had lab technicians coming in saying that they don't believe in the tests, and that the tests they're using are being mismanaged. So, you know, and there's positive control contamination and all sorts of things. There's so many more stories. And another one of a nurse who spent the majority of lockdown just watching Game of Thrones or doing yoga at work. And these are the stories that we're hearing, and they're not, but not everyone can come speak out, and that is such a shame. But I'm so grateful to everyone who came and spoke out this evening. I hope this is being informative, and I really hope that, you know, the fact that these are real people with nothing to gain, but they're just willing and impassioned to speak up for the vulnerable people in society, inspires people and gets people to take notice. Because how can you not listen to those stories and question what's going on? And it was really interesting for me as we listen to more and more, as you can connect the dots and go, oh, but that bit, and then you connect that bit with that bit. And it's a really serious problem. You know, our vulnerable people are not safe in this situation, and we need to speak up for them. And it's not saving lives, it's killing people. And I'm so heartbroken for everybody that has felt the need to commit suicide or self-harm. And I just ask you all to keep them in your thoughts tonight, because today is World Mental Health Day and people are suffering. And so think of everybody that might be struggling tonight, and maybe reach out and just send a kind message if you know anybody that might be struggling. And yeah, and if we get more people in that want to speak out, and then maybe we can hold another one of these if it'd be helpful, because there are other areas that I'd love to talk to as well, like GPs and lab technicians and stuff. So we can always do another one. But let's think of everybody that's suffering tonight and keep them in our thoughts, keep them in our prayers, and reach out where we can. And yeah, start bringing community back into our lives. And through that unity and community, we can only get stronger, and then hopefully we'll bring back hope to those that are struggling right now. So thank you all for coming on tonight, and I'll leave it there.